Hello again, this is Keith. Welcome back to Keith Speaks. Please feel free at any time to like, comment, definitely share this. I'll be talking about the vertical healthcare system. It's a system designed to keep you sick and keep them paid. Let me ask you something real quick. Um, Last time you went to the doctor, did you feel like someone was looking out for you, or did it feel like a transaction? 15 minutes in and out, maybe a prescription, maybe a referral, and somehow you left with less money, less answers, and about the same amount of problem you walked in with. Here's what I need you to understand before we go any further. That feeling wasn't in your head. That system was designed exactly the way you experienced it, and today we're going to follow the food chain. Let's start simple. When you have health insurance, the basic idea is this: you pay a monthly premium, and when you get sick, your insurance pays most of the bill. Simple enough, right? Here's what they don't show you in that commercial with the happy family on the beach. The company that takes your premium also owns the company that employs your doctor. They also own the company that processes your prescription. They also own the pharmacy that fills it. And they own the company that analyzes your health data and sells it back to the market. One transaction, 5 profit points, one company. That's not insurance. That's a toll road, and they own every booth. 5 companies, 5 corporate structures, and between them they control roughly 70% of American healthcare coverage. Let's meet them. United Health Group. This is the biggest, the one you need to understand first because every other company followed their playbook. United Health doesn't just sell you insurance through United Healthcare. They created a second arm called Optum that now generates more revenue than the insurance side. Optum employs over 90,000 physicians and clinicians. They own more than 4,000 care sites. Their pharmacy division, Optum Rx, processes over 1.4 billion prescriptions a year. And in 2024 alone, United Health quietly acquired or created more than 250 subsidiaries. Almost none of them were publicly announced because almost none of them had to be. Here's the receipt. 60% of Optum Rx's revenue comes from other United Health divisions. They are literally paying themselves. They purchased over 100 surgery centers in 2024 alone: cardiac cath labs, orthopedic surgery, ophthalmology, gastroenterology. And the Federal Trade Commission found that United Health pays its own Optum employed doctors 17% more than competitors pay their doctors. In markets where United Health has high market share, that gap jumps to 61%. They call it vertical integration. What it actually is regulatory gaming, inflating what the insurer pays its own doctors to make it look like more money is going to medical care, when it's just going around the circle and coming back home. Total 2024 revenue, over $400 billion. CVS Health slash Aetna. In 2018, CVS, the pharmacy chain, bought Aetna, one of the largest health insurers, for $69 billion. The pharmacy bought the insurance company. Or more accurately, they merged the two ends of the money chain into one entity. Now CVS Caremark handles your prescription benefits. Aetna covers your health plan. CVS Pharmacy fills your prescriptions. Minute Clinic sees you for a visit. Oak Street Health runs your primary care. And a group purchasing organization called Zinc that they created negotiates rebates from drug manufacturers. Rebates that may or may not ever reach you. The receipt? $53 billion of CVS's $263 billion in 2024 revenue was CVS transacting with itself. They own over 9,000 retail pharmacy locations. They run over 1,100 minute clinics. And as of 2024, their stock had dropped 20% for the year because the vertical integration model is starting to crack under its own weight. We'll come back to that in part 2. Cigna slash Evernorth slash Express Scripts. Cigna is the insurance company. In 2018, they paid $54 billion for Express Scripts. At that time, the last large independent pharmacy benefit manager standing. And once they owned it, they renamed the whole health services division Evernorth, so you'd stop connecting the dots. Evernorth now generates 60% of Cigna's total earnings. Express Scripts processes pharmacy benefits for nearly 120 million Americans. Accredo handles specialty pharmacy. MD Live does telehealth. And in 2024, pay attention here, they launched Qualant Pharmaceuticals, their own private label biosimilar drug brand. The insurance company is now manufacturing the drugs. We'll come back to this. Humana / Centerwell. Humana is laser focused on one market, Medicare Advantage. The privatized version of Medicare that the government pays private insurers to run. In 2022, they rebranded their entire care delivery operation under one name, Centerwell. Primary care, home health, pharmacy, all under one roof, all feeding the same senior population, all designed to keep premium dollars inside the house. Their own CEO said it plainly. If they own the primary care center and the patient is enrolled in their Medicare Advantage plan, they can, and I'm quoting here, pay themselves for providing care. Those are his words, not mine. Pay themselves. Centerwell runs over 250 senior primary care centers across the country. They have over 350 home health locations in 38 states. And Centerwell Pharmacy is the preferred mail order pharmacy for Humana's own members, steered through cost sharing structure, not because you choose it. And Elevance Health, formerly Anthem. They changed the name in 2022. Same company, 47 million covered members, and they're in rapid transition, moving away from CVS Caremark managing their pharmacy benefits toward their own in-house operation called Carelon RX. They're acquiring specialty pharmacies, building drug delivery infrastructure, and running the exact same playbook the others ran, just a few years behind. Watch the pattern. They always follow the pattern. Now here's where it gets genuinely outrageous, and I need you to slow down with me here because this is the central thing. When United Health's Optum doctor writes you a prescription, Optum RX processes the claim, Optum Pharmacy fills it, United Healthcare pays the claim to Optum, Optum Insight analyzes your health data, and the cycle starts again at your next appointment. They are the payer, they are the provider, they are the pharmacist, they are the data broker. And because they set the reimbursement rates that their own subsidiaries receive, they are also the price setter. This is not a conflict of interest. This is the interest. The Federal Trade Commission found that PBM affiliated pharmacies, meaning pharmacies owned by the same company as the PBM, were being reimbursed at significantly higher rates than independent pharmacies for the exact same drugs. They are rigging their reimbursement game against the competition while telling Congress they're reducing costs. That's not a theory. That's in the FTC's own report. Let me ask you something else. Do you even have an independent doctor anymore? In 2010, about 60% of physicians in this country were independent private practice. By 2022, that dropped to 40%, and the trend is accelerating. Your doctor is increasingly likely to be employed by a hospital system, which is increasingly likely to be owned by a private equity firm, which has a financial relationship with one of these 5 vertically integrated insurance companies. What does that mean for you? It means your doctor's clinical decisions exist inside a system that has financial incentives. Their employer benefits when they prescribe certain drugs. Their employer benefits when they refer you to certain specialists. Their employer benefits when you use certain facilities. The 15-minute appointment isn't accidental. Longer appointments mean fewer patients billed per day. Fewer patients billed per day means less revenue. And less revenue means pressure on the employed doctor to keep the line moving. They are not bad doctors. They are trap doctors. And you're in the trap with them. Last thing before I close part 1, because as I said, this is a 3-part series. But watch this pattern carefully. These vertically integrated companies built their own pharmacies, mail order, specialty, PBM affiliated. Independent community pharmacies started closing. They cannot compete on reimbursement rates because the PBMs that set those rates also own the competition. The result is what public health researchers are now calling pharmacy deserts. Communities, particularly rural and low-income urban communities that are losing local pharmacy access entirely. And when you lose local pharmacy access, you don't lose it equally. You lose it where the people are already most vulnerable, where chronic conditions are already highest, where transportation is already a barrier. This is not collateral damage. In a system this intentional, there is no collateral damage. This is the plan working as designed. So the next time you're in that waiting room, next time you get that explanation of benefits that explains nothing, next time your prior authorization gets denied by a company that also happens to employ your doctor, you will know exactly what you're looking at. You are sitting inside the food chain. In part two, we're going to talk about what happens when they start to feel the heat, when the investigations come, when the public gets angry enough that a French contractor gets shot in Midtown Manhattan, and half of social media doesn't know whether to be horrified or to understand why someone felt like that was the only option left. When the system gets exposed, watch what they do. They don't dismantle it. They rebrand it. They restructure it. They call it Trump RX and tell you it's a deal. Stay tuned for part two, the shell game. Thank you again for viewing Keith Speaks. I do appreciate it. As I said, please feel free to like, comment, absolutely share. See you next time.